Good morning, good afternoon, good evening, wherever you happen to be. Thank you for joining us here on Organizing in the Time of COVID-19. Today, we had a very interesting guest coming to speak to us about Mozambique and the situation there. Um, as of April 10th or so, Mozambique had about 20 cases of COVID-19, and what sounds like quite an impressive program of trying to deal with it. But this is in a context in which there have been what some people might call a civil war occurring in Cabo Delgado province, where lots of outside forces as well as internal are creating conditions of havoc. I'm really pleased to have today Boaventura Monjane, who is a journalist and has worked extensively in Mozambique, South Africa, Brazil, Spain, Portugal, France, and a real pleasure because um, Boaventura was the editor of the Portuguese edition of Pambazuka News. So it's really a great pleasure to have him back on this program. So a warm welcome to you, Boaventura.
Thank you, Firozi, for having me. It's always a great opportunity to exchange ideas and views with you.
Thank you, thank you. So I know that you're stuck in Cape Town because, of course, you can't move back to Maputo. But but can you give us some sort of idea from what your knowledge and your contact with people, what is the situation in relation to COVID in Mozambique?
Yeah, the situation is pretty complicated. I mean, although we have a few confirmed cases of people infected, the picture shows that the situation is gonna change and it's gonna be worse in the coming weeks and months. And one of the issues that has been worrying us is that the Mozambican health system is already erratic and it has no capacity to deal with this crisis, with this pandemic. We already have our own challenges. Mozambique is a country with a lot of malaria, people with malaria, cholera, and other diseases. And the health system in Mozambique was already very much heavy, and it was not already being able to respond positively to the needs of the Mozambican people for health services and equipment and doctors and all the apparatus and all the infrastructure to respond to people's need. Now, with the arrival of coronavirus, the situation will definitely become complicated. My government is asking for support, international support. They've been meeting some donors, mostly the World Bank and IMF and other donors from European Union, to support them with some financial means, especially to buy ventilators and other health kind of necessities, medicines, and probably hire new doctors and things like that. So people are kind of scared. They don't know what is going to happen, and it's a matter of waiting and see.
When you say that the situation is likely to get much worse, what makes you feel that?
Because already in Mozambique, people die in public hospitals. People are not able to get the best treatment. The private sector is very expensive, and most of Mozambican people have no private health insurance. And the situation will be complicated in the sense that it's going to be an humanitarian catastrophe if the cases of coronavirus multiply in Mozambique, because simply hospitals will not be able to treat everybody, and they will not be able to contain the disease. And of course, a lot of people will get infected.
So what can you tell us about the government's public health strategy to deal with coronavirus?
So it's not very clear what the government is trying to do. You know, the government declared the state of emergency end of last month, which has started as is in place. It has started 1st of April for 1 month, and some other measures were taken, such as prohibiting people from being in public spaces without a face mask, and all of these things. But the health system as such has not shown any visible change or transformation to respond to the COVID-19. What I sense is that the government is just waiting to see what will happen, but there is no clear strategy that we know of to respond to this crisis. So we are very preoccupied. As I said, the government is right now busy raising support, asking for money. But as you might also know, Mozambique is not enjoying a good fame now with regard to managing, donors' money. We were involved in a big financial scandal a few years ago. And so the international community, the donors community, is very skeptical to give money to Mozambican state and government because of what happened in the past.
Right. So, I mean, if my understanding is right, like many of our governments on the continent, the strategy essentially involves social distancing, hand washing, and no gathering of people. Is that right? Is that the essence of their strategy?
Yes, the state has asked all Mozambicans to observe social distancing, stay at home. Only essential services are allowed to operate. But the question is, how will people observe social distancing if most of Mozambicans depend on daily income to eat? And for you to have an idea, only 10% of people that are economically active are employed or are wage laborers. We have a huge, overwhelming informal sector in Mozambique. That those are people that do not depend on any official company or official entity. They are on their own, selling on the streets or doing, kind of informal trading. And we have, the vast majority of Mozambican population are peasant farmers. They are small-scale farmers that are also working on their own. So if social distancing is to be observed, then that means that we will also have a very difficult situation in terms of livelihoods for people. So of course, people are asked to do what they can, to wash their hands, to buy sanitizer, to stay home. But the question we have been asking is, how will that be possible? So civil society in Mozambique has come with a response, an articulated response. We have published recently on Friday last week a position paper in which we tell the government that, while we understand the declaration of the state of emergency, we are worried about what will happen to people in terms of, income, in terms of security, in terms of their human rights, and so on and so forth. So, yeah, the situation, as I said at the beginning, is pretty complicated.
So I mean, certainly the last time I was in Maputo, I saw a growing number of people living in shacks, a large and growing what people would call a slum area. And what does social distancing mean in that situation? When people are crowded together, they have no access to water or health facilities, and it's all piling up on top.
Yeah. Well, of course, the situation there is even more complicated. We do not have slums like Kuguleto and Kailicha in South Africa, those very complicated slums, but we do have informal settlements that, face a very difficult kind of issue because they cannot self-distance because, the settings of their neighborhoods cannot allow that. They live in bulks, if I can say so. They cannot, avoid contact with neighbors. And as I said, more importantly, they need to hit the road in order to eat. So it's a very complicated situation. I think some of the government measures will be easier for the middle class to observe, but it's going to be very complicated for those who live, as you said, in slums or in bairros, as we say in Mozambique.
Yes. It seems to me that in many of the African countries, people have been commenting saying that this social distancing policy is a policy of protecting the elite and the middle classes from infection from what they presume are those people who live in these awful conditions. Is that something that you would agree with?
Well, I don't think that will be possible in Mozambique if you take into account that most of the people that live in the informal sectors or in the kind of popular neighborhoods, as we say, bairros populares, they work in towns for the middle class, as domestic workers, or in one way or another. Firozi, my screen is frozen. Are you still there? Can you still?
I'm still here. Can you hear me?
Sure. Okay, I will continue.
Yeah.
So as I was saying, there is you cannot separate the periphery with the center in Mozambique because these two worlds coexist and they interdepend to each another. So it's I don't think that is something to agree with in the context of Mozambique. There is no center without the periphery.
Right. Let me, this is all happening in the context of growing insecurity, and some people call it a civil war, with gas companies, mining companies, lots of different religious groups, Catholics as well as Muslim, and an area which many people in the popular have been neglected and are susceptible to opposition, which has become over the most recent period an armed opposition. And whether or not this is jihadist, ISIS, or whatever, could you say what is going on there, and what are the implications for both COVID developing and in terms of the government's ability to deal with this?
Yeah. Well, Mozambique is a country that has been under military conflict since it was born. We had a severe civil war, 16 years long civil wars that was kind of it's known an interregnum after we changed our policy in Mozambique to become a multi-party democracy. But then, the guerrilla, the former guerrilla movement, Renamo, never de-armed itself, and it always activated their their military kind of army whenever they wanted. So Mozambique was always in that conflict and that hectic situation. The Cabo Delgado phenomenon is new in the sense that it does not involve Frelimo. So it's a conflict of a different type. And of course, this has been claimed by the Islamic State, like as you said, jihadists, and so on and so forth. And there is also a religion kind of element. But the truth is that Cabo Delgado phenomena is happening because of the resources. So Cabo Delgado conflict is a resource course. It's only happening because of the wealthy that is in that province. And you cannot explain Cabo Delgado without the gas, without the rubies, without the graffitis and other minerals there. And of course, the state of emergency won't be quite implemented in a situation where the country is under a war. You call it civil war. I think I wouldn't call it a completely civil war, because I think there are strong foreign interests there. I don't think it's a war that is primarily between Mozambicans. So I wouldn't classify it as a civil war. But of course, there are some local kind of people that have been activated to join those, as we say in Mozambique, insurgents. Now, I spoke a few days ago with a peasant leader in Cabo Delgado, in Palma, one of the most targeted districts. And he was telling me that he is very much worried about how the state measures and the state decree that has been promulgated will work in that context. And he fears that the situation will worsen the situation of the peasantry. He says that peasants won't be allowed to go to their mashambas, to their fields, to grow food, both because of the implementation of state of emergency, but also because of the military conflict in Cabo Delgado. So he also raises the issue of hunger, the issue of productivity, and worsening poverty in Cabo Delgado.
And it's not just Cabo Delgado. I mean, if I recall right, there's been this great alliance between Brazil and Japan in occupying a large section of Mozambique for their own production, which the government has given them license to occupy and remove people from land which they have been tilling for thousands of years. Could you say a little bit more about that?
Yeah, you're talking about the Pro-Savannah program that has been introduced in Mozambique in 2011, which was an alliance between Mozambique, Brazil, and Japan. The idea of Pro-Savannah was to replicate what Japan did in Brazil, in the Cerrados area of Brazil, in the late 60s, if I'm not mistaken, where they have transformed, very biodiverse area, into a monoculture area, a monoculture kind of intensive farming of soya specifically. And they've expelled local population, they've destroyed biodiversity, and they have also compromised, people's livelihoods. And that program was called PRODECER, and it has been seen as a successful program because it has, intensified Brazil's agribusiness, and it has allowed Brazil to export soya to Japan and other Asian countries. So that they wanted to replicate that in the Nacala corridor in central northern Mozambique, an area that is also very complex. One part of that area is the area where Renamo has been operating, but it's also the most fertile area in Mozambique with, rivers running, impressive biodiversity, and also it's the most populated area in the whole Nacala corridor. We estimate that more than 4 million people live there. So Pro Savannah wanted to replicate the Brazil's PRODECE. And of course, that was resisted, and it didn't succeed. By the way, there was a strong social movement in Mozambique that was led by the Mozambique Union of Peasants, UNAC, and it was a movement that involved a lot of other civil society organizations of different sectors. And the movement was also very quick to internationalize itself, right? Like the movement had, partners in Japan and Brazil and in other countries. So it was possible to put a lot of pressure into the Mozambican state, but most importantly, into the Japanese side to halt it. And Pro Savannah has been transformed. It's not anymore what it was supposed to be. They've now changed the language and also the strategy and the master plan. So in my analysis, I think Pro Savannah was defeated. We don't see what they proposed at first place happening. Now that area has been knowing a lot of land conflicts that are independent to Pro Savannah. So we've been seeing capital penetrating the agribusiness being pushed to that area, involving some political elites at the expense of the peasants. So we've seen, displacements and land grabbing happening. But it was not Pro Savannah. Pro Savannah was coming to boost even more those kind of dynamics.
I raise it because I think it's an important lesson that we've learned, that it is possible to organize against forces which are quite considerable. I mean, we're not in Brazil and Japan are not small players on an international level, and civil society was able to organize around that. So I think it's important for people to understand the strength of organizing that goes on. So, which leads me to the question that really the final question is to say, what are the challenges of organizing in the context of COVID, and indeed in the context of the whatever it is, the war that is happening in Cabo Delgado?
Yeah. Well, we come from a tradition or a culture in which the state has not yet understood the role of civil society and social movement, and whatever is done has a contestation to whatever the state says or whatever the policy the state puts in place. It's seen as an opposition to the state, or opposition to the government, or opposition to Frelimo. Our state did not understand the role of civil society in a democracy. So it's very likely that, when people try to organize themselves, the state reacts in a very violent manner. And this does not happen only to civil society organizations, to social movements, but also to independent press or progressive intellectuals or academia. So in the last years, we have seen a state that was very brutal and violent to people that think differently. Nevertheless, I've been seeing in the last 10 years a stronger civil society in Mozambique that has been able to articulate a number of agendas to contest whatever state measure that is perceived or is seen as inimical or hostile to the people. And the case of Pro Savannah was, of course, a very successful case. But I mean, successful in the sense that I'm not saying Pro Savannah was completely defeated, but it has been hibernated in one way or another, and it has been transformed. But now, in the context of COVID, we have seen a very rapid response from civil society. As I told you at the beginning, on Friday, a coalition of 50 civil society organizations, including trade unions, rural movements, independent activists, academics, artists, have put forward a document, 12 pages document, in which they present a very interesting analysis of how the COVID or the state of emergency in Mozambique will impact people, mostly the vulnerable or the poor. And they've come with a number of demands and proposals for the state in order to reduce the bad impacts. But of course, it's really very difficult in the context of Mozambique to organize because the way the state sees civil society or social movements is not in a way that I'm saying this because, for instance, one of the approaches of these allies, this coalition that just emerged as in the context of the COVID, also wants to collaborate with the state and with the government, especially with regard to informing the population, spreading prevention kind of information and so on and so forth. But that will not be very easy to partner with the state or with the government, because, as I said, the culture is that civil society organizations are against the state or are agent of the opposition. So the Cabo Delgado current military conflict is even a worse situation, because it's very difficult to articulate a response to that, because the state has, for instance, surveilling a lot of press. A lot of journalists have been arrested that were simply covering the conflict in Cabo Delgado, because the state understands the intervention of civil society into that dossier, into that matter, has a national security issue. So it's very difficult to organize a response to the Cabo Delgado military conflict.
So, what are your final message that you want to convey to people who are watching the show?
Well, I don't know who your audience is, but there's a lot of things that can be said. I think I think your program is in the context of COVID, so my message would go on in line with that, to say that this pandemic is showing us the importance of solidarity and the importance of togetherness. And I think that we have to understand that fighting this pandemic is it has to be a global response, and whatever we do as citizens, as academics, as government officials, has to have an approach that is beyond our boundaries, is beyond our country, and look at the world as one. Because as we know, no country is safe if any other country is affected because of the mobility of the virus. So it's important for us to learn the message that solidarity is very important, and it's also important for the left or for popular movements around the world to see this pandemic as an opportunity for them to strengthen ties and strengthen collaborations and build a global movement. I wouldn't say global left. I would like to say so, but it seems like it's a very controversial kind of things to say today. But a global people's centered agenda that would see politics and see societies today has connected. I'm talking here about what Boaventura Santos would call a counter-hegemonic globalization, which is a globalization of social movements against the globalization of capital. So that will be my message. Let's be alert. Let's communicate among each other, and let's expose authoritarianism, militarism, and other abuses that can be put forward by those who are powerful today in the name of fighting COVID-19.
That's a wonderful message. Thank you for joining us on this show. Really nice to have you with us. Um, People might find there's a really excellent edition of Africa Focus, which was published only today on the current news on Mozambique, and the web link is shown on the screen there. It's certainly something that we should definitely make sure that you catch up on. There's lots of cultural information, there's music, but there's also quite a very good analysis by Joe Hanlon and others on that site. So I very much advise people to catch up on that. Boa, thank you very much for appearing on our show. I wish you well, keep safe, and keep well.
Thank you, Firoz, and thank you for inviting once again.
That was Boaventura Monjane, and thank you for joining us today. We will have a busy week this week with people from Mexico, from around Africa as well, and so please keep coming to follow our show. This is Firoz Manji signing off.